Hello, 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 everyone. Welcome to Ask the Nanny. Tonight, I have a special guest, and I know a lot of you have been asking and wondering, and I see people showing up. So, what I want you all to do, if you're watching, please share to your nanny groups, to your friends, to any nannies that you may know who need health care. Please share this with them. Um, I'm going to let Jeff introduce himself. And while he is introducing himself and telling you all the fine details about himself, I'm going to share this with a couple of groups myself. Oh, we already got a heart. Somebody's already in love. Okay. So I'm going to let Jeff introduce himself. And while he's introducing himself, I'm going to be over here posting to some nanny groups. So, Jeff, take it away.
Sounds good. Thank you, Angela. And hello, everyone. Thank you so much for having me, first of all, on Ask the Nanny. It's a great platform and honor to be here. So my name is Jeff Yuan. I am the co-founder of a company called Taro Health, and we'll talk a little bit more about today how we kind of help and support both nannies and families when it comes to healthcare. I am a proud father of a 14-month-old as well. And I think part of how I learned much more about the nanny industry is through my own personal experience and my professional experience in healthcare. I've been in healthcare my whole career. And as I learned much more about kind of the nanny industry and actually going through the process of getting our own nanny, I actually learned, to probably not too surprisingly to many of you who are listening, that a lot of nannies just don't have great access to healthcare or health insurance. I think that's changing now. And so, part of what I wanted to share is how my company can help get involved in terms of bringing more awareness of different healthcare options, and how we can just get better access for really everyone, but specifically how this might apply to a lot of nannies out there who are looking for affordable and convenient healthcare options.
Yes. Okay. One more thing.
Sure.
Fun fact.
Oh, gosh.
I know. I didn't tell you because I always put everybody on the spot. So one fun fact or two.
Gosh, I feel always lame when I say these things because but I will say, so in a previous life, I worked in healthcare. I was a consultant. And so I have traveled to all 50 states in the US. I've been to every single one of them. Wow. And it's one of those games early on, you have to, I feel like you go to 20 of them and you just feel like you got to go visit all 50. So I've been fortunate enough to visit all 50 states in the US.
Wow. Okay. I thought I was, special. I've lived in 10 to 12 of those states. So
that's not bad. I've only lived in 2 or 3 states, but
and I have moved about 31 times since I was 20 in the last. So basically I'm averaging one move per year over the last 30 years.
Wow.
So yeah, but military, that's all I'm gonna say. Military. But yes. Well, we appreciate you coming and sharing with us. And I know you said something in the email to me that I'm curious about. You mentioned the difference between health insurance and health care.
Yeah.
So tell us the difference between the health insurance and the health care, because I know yours is health care.
That's
and
right.
Not health insurance, because I thought it was a health insurance. I was like, okay, this is insurance. And I'm like, and then when you said, no, this is not health insurance, I said, wait a minute, what is it? So, Okay, tell us the difference for my benefit.
Sure.
What's the difference?
Sure. Let's start with maybe health insurance first. I think most people identify with health insurance. Health insurance is basically how most people think about both health care and health insurance. Many of you might have health insurance or know folks who have health insurance, and it's insurance. It's just like car insurance or home insurance. It protects against the really, really bad things that might happen to you. If you get into a big accident, unfortunately, or need surgery or have to visit the hospital. As we all know, these could be very high dollar events, and health insurance is really meant to cover that. I think most Americans, they think about their health care through the lens of health insurance. If you need to go see the doctor, many people quickly turn to their health insurance to figure out, how can I actually pay for this thing? But what's unfortunate, I think, about how health insurance has evolved in the last decade. It's getting more and more expensive, which I think many of us can relate to. And even if you actually get health insurance, you might have a really high deductible, which if something happens to you, you still have to pay out of your own pocket, which kind of defeats the whole purpose of why you're even paying for health insurance. And so the reality is, and we work in the industry, everybody, nannies included, many people have health insurance, but still don't have great health care. That means that they don't have easy access to the doctor. If they get sick, can they actually talk to somebody or see a doctor within 48 hours to get something treated? They might have to call the office and they might hear, the doctor can see you in 4 weeks. That's the next available appointment. Well, that's not really great health care, especially when you're sick and hurting. So
I could be dead by then.
That's right. So all to say, health insurance is what most people think about. And healthcare is included in a lot of people's insurance. What we'll talk a little bit about today is how we're trying to provide better health care that's a little bit separate from insurance. And that's great access to a doctor that helps with 90% of all of your everyday needs.
Good.
Yeah.
Okay, so your company provides health care. How does what is the process of getting the health care?
Yeah. Maybe to explain a little bit about kind of what our company does and the doctors that we work with. So everything I just talked about with health insurance is frustrating, I think, with a lot of patients and nannies who are looking to find access to a doctor. What a lot of people don't know, if you don't work in the healthcare industry, is the doctors are really frustrated too. Many of them have to spend lots of time documenting everything just so that their insurance company can pay them for all of their visits. So, and then they hire staff and all sorts of folks who bill and code to make sure that all the claims and things like that are being processed. So maybe that's a little background information. We work with a different set of doctors who used to work for all the large hospitals and health systems, who recently left to start their own independent practice in which they actually work directly with patients, not with insurance companies. What they are trying to do is actually reduce the cost and build more meaningful relationships with patients and be able to spend more time with patients as opposed to doing a lot of insurance paperwork. So those are the types of doctors we work with. Now, the first question you might say is, oh gosh, these doctors don't take insurance, right? But when we worked with the doctors, we found something that was really interesting. We asked them, well, who are the types of patients that come to you? Who are the types of patients who work with you if you don't accept insurance? And they said, in fact, we work with a lot of uninsured people. We work with a lot of nannies. We work with a lot of caregivers. We work with a lot of gig economy workers and freelancers and basically anyone who is self-employed. These are the people who are kind of falling through the cracks of getting healthcare. They're stuck between a rock and a hard place, and they've kind of left their large hospital jobs to go really serve the community. And so there's something interesting about the doctors that we work with. One, they offer unlimited visits with all their patients. You can literally see the doctor 1 time a month, 5 times a month, however many times you want. You can go on a video call, just like what we're doing right now, and there's no extra fees. You can text the doctor directly. And when you go see the doctor, you can see the doctor for 30 minutes, 60 minutes, 90 minutes. You don't really get rushed out the door. And then finally, the doctor is always available same or next day whenever you need them. So you'll never have to go to an urgent care center. And they do this all for a flat monthly price. So think of this almost like a Netflix for healthcare, or even like a Costco version or something like that. It's very simple. No middlemen, no insurance company, no co-pays, no additional fees. We're all consumers. We subscribe to different services. You can subscribe to a doctor, and that's becoming much more popular these days. And we're seeing a lot of nannies and other folks kind of gravitate towards it.
Okay.
Yeah.
So I can just pay my membership and call the doctor whatever. Do you give a list of doctors that are in my area, and what area? I should ask what area these offered in?
Yeah.
Because I know she's a pediatrician,
Yep.
but she works in the Dallas area,
Yep.
and she has her own practice. But what area does your group cover?
Yeah. So our group currently just launched in a couple of markets and it's been going very well. So our goal is actually to go across the country. Right now, we're very much in New England. So we cover Connecticut, Massachusetts, obviously the greater Boston area. We're also in DC and Virginia, statewide in Virginia. So up in Northern Virginia, as well as the rest of the state. So those are the two areas that we just launched in. But one of the things we're trying to do is to see if there's more interest across the country. And then we're going to start growing across the country where basically any nanny can really get access to this. I will say these type of doctors exist across the country right now. What we do as a company is we help pair a nanny directly with a doctor so that the two of them can meet for free, actually, on our platform. And then either the nanny or the family can decide whether they want to join the practice. One thing I will also point out, everyone probably asks, well, what's the price point for this? The price on average is roughly about $75 a month. It varies by location. It also varies by age. So the range you'll typically see is anywhere between $50 to $125 a month. And that covers everything I just mentioned. When we talk to a lot of families and we talk to a lot of nannies, they say if they have to go buy health insurance, it's $600, $700, $800 a month or more. So, we feel $75 is quite affordable for getting 90% of your everyday healthcare needs, annual physicals, weight loss help, diabetes, preventative care, all of that is included.
That's awesome.
Yeah.
See, I just went to the doctor today and was rusty. I hadn't even filled out. She said, you got 2 pages front and back to fill out. So I'm trying to take my time so they'll be able to read my writing because,
Mhm.
I just scribble stuff down and keep going. I was like, they need to be able to read this. So I'm writing and I'm trying to be patient. And I'm like, okay. And I get to the 3rd page and I'm on middle of the 3rd page and they call my name. Okay, just put your stuff right here. You can finish that out later. Okay.
Mhm.
So I get done in that room because I was getting my eyes checked. Okay. Then I sit literally, my behind hits the chair and I'm back up. The doctor's calling me. I'm like, okay. So he takes me in and okay, look, can you see this? And what about this? And what about that? And I'm like, okay, can you slow down? And,
Yeah.
and then I hear the nurse knock on the door and she said, well, we have patients and we have, he said, okay, we're coming. And so basically I'm herding you in and I'm herding you back out.
Yeah.
So I was like, but then I have a special case because I had an injury in my eye
Mhm.
and he's like, he slowed down. He said, wait a minute, hold up. He said, there's something different about your eye. I said, I have your attention now, huh? You're not just
Yeah.
hurting me now. So then he took his time and he talked to me and he gave me a referral to an ophthalmologist who
Yep.
a specialist who could actually see my eye and give me drops and everything. That's when he slowed down. I hate being rushed at the doctor because if I have
Yeah.
questions, I need you to answer them. I need to feel safe and secure that I came to you. I'm
Yeah.
paying you my money. Now,
Yep.
you don't know how hard it was for me to come up with this money, how many extra babysitting deals I had to do to pay to get health insurance, because a lot of us, we go and go and go until we just drop.
Yep.
And then when we get sick, some of our families get mad at us because we don't have a backup. How dare you not come to work today? How dare you get sick? You're
Yeah.
supposed to be at work. Well, we are our own, we're our
Yeah.
own backup.
Yeah.
So, and I try to tell parents, please have a backup system. Please, I mean, if it's just you and dad, anything could happen to me.
Yep.
But I also know that if something happens and I'm gone too long, like when I had the last time I had surgery on my eye, I had 2 part-time families, both of them gone because I
Yep.
was out too long.
Yeah.
So it takes, I want to be able to feel secure in first meeting you and then secure that I can ask you any questions and you won't rush me out.
Yep.
Now, let me ask you this. Do the doctors have offices or do they make house calls or how does that work?
Yeah, great question. So all the doctors have their own offices. And to your point about the relationship, they deliver care the way the patient wants to deliver care. And I'll give you a couple examples. You can come
Okay.
in person, you can do a virtual video visit like telemedicine, like what we're doing. You can
Mm-hmm.
call the doctor, you can send the email to a doctor, or many of the doctors just give their personal cell phone numbers directly and you can text the doctor, or the doctor can actually go directly to you for a house call. So it's really almost like the way healthcare used to be, a little bit more old fashioned.
I
It's
like that.
it's a doctor patient relationship, and it's affordable, and you can have access, and you can actually spend time with someone who takes the time to listen to your concerns, answer your questions, and actually have time to think about what's going on. What you just described, Angela, the sad part is that's how most people experience their doctor these days. And I think what these doctors believe that's not real healthcare. Real healthcare is taking the time to listen, being there for the patient when they need them. The one thing I will mention is, and why this has been really popular with nannies, it's not like nannies can just drop everything on a 3 o'clock or 11 a.m. to go see the
Yeah.
doctor. A lot of times they'll have to maybe call at 7:30 in the morning, or they get off at 6. The doctors are available then, and so having that convenience to be on a nanny schedule is also just really, really popular with a lot of the nannies that do this.
Yes.
Yeah,
Yes. You just said magic words. Because I still, even though I'm in pain, I'm still at work, but I
yeah,
need to be able to go to and it's hard to take off. And sometimes I know they have good intentions, but sometimes uh moms and dads get caught up in work and they get home late. So we get to the doctor late, and they have the policy. If you're 15 minutes late, then you have to reschedule.
hmm,
So if they were late and then we're late, and then that's money that we still have to pay
yeah.
in order to see the doctor. But it's just it when you said they are still open after work, you said the magic word. Yes, it's like a unicorn. They are still,
Yeah, it's
hold on. Let me say hello. Hi, Glory. Hi, Lucretia, and hi, Mitch. How are you all? Thank you for joining us. Um, also, Laura said hi.
oh, that's
Laura
great.
Brawley. She's
Yeah,
like, she's
she's
like,
wonderful.
good to see you both. So Laura was the one. And just in case you all don't know, Laura Brawley from the it's not it's the Nanny Cauldron now. Um, she was the one who introduced Jeff to me because she talked to him first, and she said, you need to introduce him to, and this is something good for the nannies. So I was like, oh yeah. So I jumped on it real quick. So I needed to bring it to you all because I know how I was when I didn't have health insurance. I
Yeah.
know how I was when I was just working part-time and somebody hit me from behind. Well, if it had been me hitting somebody else, I don't know if I would have gone to the doctor because I'm like, I'm only working part-time, and my little pennies, I gotta pinch them, I gotta eat, I gotta pay, I don't want the water to go out here. It is a lot.
Yeah.
Shannon says, I have an eye phobia, so thank you for not going into details about your poor eye. No, she knows the details of my eye. I'm not going into the details of my eye. Most of you all know the details of my eye, so I will spare you that. But yes, I love the fact that she saw the need. She knows me, and she's
Mhm.
like, "You had a platform, give it to the people." I'm like,
Yeah.
"Here it is." I've been
No,
looking forward to this topic so much. Okay, so Shannon, if you have any questions, ask now. So Shannon is one of my good friends, nanny friends. But yeah, it's hard for us to just get off work
yeah.
and go to the doctor. And then with COVID now, it's
Yeah.
even harder because if you're not sick, don't go to the doctor. It's
Yep.
it's like that phobia of if you're not dying and something hanging off of you, don't go to the doctor because you'll get sick at the doctor's office, you know. But she says so far I'm hooked. This is not insurance, Shannon. This is healthcare. There's a difference.
Yeah.
I just learned that. There's a difference. And I'm not sure. She's in Atlanta, in Georgia. Um, I'm not sure. Your company is in
So
New England area.
we're in the New England area. We're also in like the Virginia statewide and DC area, but we are going across the country. And if you go to tarohealth.com/nannies, you actually enter your information. It helps us understand kind of where to go next. And so
Okay.
if you are interested in this, please go to the site, learn a little bit more about it, enter in your information, and it'll help us understand like what's the most logical place to go next.
Okay.
The one.
Go ahead. No, I was going to say you're welcome.
The one other thing we've learned about this is, as I mentioned about the price point, it's much more affordable than health insurance. It just depends on everyone. But the stories we've heard is a lot of nannies have been faced with a $500 premium or $600 premium or $700 premium a month, and that is not cheap, as we all know.
Mm-hmm.
The average price point for this is about $75 a month. And what we have found is a lot of nannies will pay for this directly by themselves. But many of the families who wish they can give some sort of health benefit for their nannies, but can't afford providing full-blown insurance, will provide this for their nannies because $75 a month is much more reasonable for them. And the nanny then has, as I just mentioned, 24/7 access to a doctor, flat fees. They can do their annual physicals. They can take care of any of their other chronic conditions, help do holistic or preventative health, all the benefits that we had just talked about. And they have that flexibility and convenience with their schedule. So I'll say what we've seen so far is, again, nannies will pay for this themselves, or we actually help them bring this to their families to see if this is something that the families are willing to help contribute, because it's much more reasonable at $75 than a $500 premium.
Yes. Can y'all say perks, benefits? I mean, I would rather get paid less. I know $1, $2 less an hour and have this perk or this benefit, knowing that it's being paid for me, and I can go at any time I want to, than to be paid, I'll pay you extra $3 or $4 an hour. And that $3 or $4 an hour to get on the insurance is still not even close to half of what that insurance premium is.
Mm-hmm.
So I'd rather you just, pay this instead of paying me, you can do both. By all means, do both. But I would rather you pay for, make this one of my benefits.
That's right.
Make it as a part of it, because I guarantee you, any nanny who is going to be treated fairly, who is going to become as a family member, and you're paying insurance, this is a benefit. Yep. Oh yeah, okay. So what else? What else do you expect? Okay, yeah, this sounded pretty good to me. Yes. Yeah. Okay, come on, let's sign the contract. Yes, this sounds good to me. How long do you predict it will take to get to the Southeast?
In the Southeast, we're actually looking at the state of Georgia and in the Atlanta area right now. So our goal, hopefully, maybe is in the next couple of months, we'll be there. So short period. We just launched. We've seen an incredible amount of success and interest in this. And so our goal is to kind of keep going so that this is accessible to as many nannies as possible across the country.
Yes, there are plenty of nannies in the DC, and I used to live in DC.
Yeah,
I can tell you there are plenty of nannies in the DC and Maryland and Virginia areas.
Yeah.
Yes, and yes, because most of us live in Maryland and we work in DC.
Right.
That's what I used to do.
Right.
So it's cheaper to live in Maryland than it is to live in DC.
Right.
So we commute in because the train goes everywhere. That subway goes everywhere. So yeah, I love it. I love it. I love it. So be on the lookout, Shannon, because it's heading your way. They're looking at it right now. So be on the lookout. Now, as far as how long does it take to get signed, or do you have to have a a physical or anything to get this? Is it like life insurance where you have to have a physical to make sure you're okay before you join?
Yeah, so this is the great part about this program. I think, even the premise of that question, Angela, goes to show you a little bit of how scary insurance can be and healthcare can be. It's, are you eligible? Are you not? There's only certain times you can actually enroll. There's pre-existing conditions. There's a lot of barriers to
Hmm.
healthcare and health insurance. There's also a lot of just lack of transparency. It's complicated and it's scary for a lot of folks. So the nice thing about this is everyone is eligible. There's no pre-existing conditions. You can enroll literally at any time that you want. And it's because these doctors have kind of removed all the barriers and decided to work much more directly with patients and nannies. One just quick story I'll share. When we were going through the process 14 months ago of finding a nanny, we found someone wonderful. We put, started an EIN and we paid them on payroll. And as someone who worked in healthcare for his whole career, one of the first things I thought is, how can I provide health benefits as an employer? And I started researching a lot about this, and this is something you know very well, but of course all the viewers know well. Not every nanny gets paid, obviously, above board. Many get paid on the table, and then
Hmm.
many of them are documented. Some are undocumented. And what we actually found is across all those spectrums, paid above board or below the table, paid, or if you're documented or undocumented, no matter what your situation. Um, the process of trying to understand health insurance and look for health insurance can be scary. We talked to some undocumented folks and they just said, it's scary to go get health insurance sometimes. We don't really know what to do. We don't know what information we have to provide. Um, and so this is something that you just work directly with the doctor. There's no kind of large hoops to jump through in order to kind of get access to it. And again, that's what a lot of these doctors believe in the mission is to serve their community, and just to help reduce as many barriers as possible for people to get great care.
Yes.
Yeah.
So you don't have to jump through hoops. It's affordable healthcare. You have access before and after work. Oh my gosh. Okay, so I'm harping on that one because I had to wait until after work to go to the doctor. Okay, how long are they open? Okay, I think I can make it at that time. Let me rush
Yeah.
over there. And then I rushed back home. I was like, okay, let me eat something. I gotta go do Ask the Nanny tonight. And so yeah, it is a hassle just to go to the doctor. And then the top of the even my because my insurance is through my husband. A
Hmm.
lot of nannies are not married
Yep.
and husbands and don't have the backup support that I do. That's why I'm so appreciative. But even still, I had the doctor's the vision. Let's just say this: the basic insurance does not cover eye insurance.
Hmm.
It does not cover dental.
Yep.
My husband and I both Um, my husband can't see out of his right eye because of the injury. I can't see out of my left eye because of the injury. So we kind of stand together. He's like, you cover that side, I cover this side. So, but even still, we had to pay extra for the eye insurance and pay
Yeah.
extra for the dental insurance. And then on top of all of that, I have to see a specialist because of the injury in my eye. So that's counted as a special what is it called? Special it's a special doctor, a special something. Anyway,
Yeah.
it's cost more. It's like to see a regular doctor is $20 copay. To
Yeah.
see a specialist, I had to pay $40.
Yeah.
So seeing a specialist, it goes up. And I'm just
Yeah.
like, really seriously? And if I couldn't afford the doctor, what makes you think I can afford the specialist? So it's just like piling on and piling on and piling on. And if you don't have this spectacular high net worth family that you're working with
Yeah.
and making all this money, or have a husband that has a medical plan at his job, and please don't let him lose his job because then we lose the insurance.
Yeah.
So it's just a lot.
Yeah.
And knowing that this is out here and knowing that it is available, and I can go and see the doctor and they can give me a prescription and give me what I need to write me a prescription, give me what I need in order to get well. Just a basic physical
Yeah.
is a lot.
Yeah.
It's like $150. And
Yeah.
that was like 2 or 3 years ago. So I don't
Yeah.
know what it is now because my insurance pays for it.
Yeah.
But if I had to pay it out of my pocket, I'm sure it'd be more than $150.
Yeah. That's right. That's right. And you brought up something really interesting, Angela, which is, I think, pretty consistent in our current healthcare system, which is just the lack of transparency, right? Most
Mhm.
people, when they go to the doctor, they have no idea how much it really costs. Everyone's kind of crossing their fingers they don't get hit with a surprise bill 3 months later or 6 months later, right?
Mhm.
And so I think part of what these doctors are trying to really pioneer is something really rare in healthcare, which is price transparency. We have it in everything else we do when we book airline tickets or book a hotel, when we pay for Netflix or like, these things are all transparent. And so
Right.
the nice thing about this is once you become a member of the practice, on average $75 a month, like I said, every single time you see the doctor, there is no copay. If you call the doctor or the doctor calls you, you don't have to worry about some random charge showing up in your mail maybe 3 months later, right? So the flat, consistent cost gives people predictability. It gives people peace of mind that they don't, that they may not get kind of in the current system.
So you mean we don't have to pay $5 for the Band-Aid?
No.
Because I've been to the emergency room a couple of times and it says Band-Aids. It was $5. You gave me one Band-Aid. That's 3 or 4 boxes of Band-Aids, people. I'm
Yeah.
like, really? One for $5? So, it's those little hidden and they okay, so we put a little drop in your eye. That's $150 to
Yeah.
dilate my eye.
Yeah.
$150 because I'm in the emergency room.
Yeah.
I'm like, really? Seriously? That whole bottle probably cost you $30.
Yep.
And you can serve about 60 patients out of that. So let's say 50 cents. You charging me $150. So it's little hidden charges like that.
Hmm.
I don't like surprises, not like
Yeah.
that. And you're like, okay, and you're standing there at the cash register, and the lady said, "Okay, we ready to check out?" Yeah, yeah, I think so. Here you go. Slide the piece of paper across there. And you're like, okay, yeah. How bad is it gonna be? That'll be $399. Is that with the insurance? Well, you haven't met your deductible yet.
Yeah.
And I'm just like, okay, let me pull out a couple of more cards. Okay, that's $50 on that card. Take 200 off of that card, and okay,
Yeah.
put the rest on that one. And literally, it is almost like that when you don't have the insurance to pay for everything, or the insurance doesn't cover it, or you
Yep.
haven't met that deductible. And speaking of deductibles, is there a deductible?
There's no deductible. It's very straightforward for us. And I will point out, right? We've been having this conversation about health insurance and healthcare.
Mhm.
The reason $75 and all the good benefits too is that it covers 90% of your needs. If you want an annual physical, rash, skin thing, asthma, weight loss, prediabetes, it covers all of these everyday care and preventative care. So all of that is covered. I will say, right, there is a role and there's a place for health insurance, right?
Right.
These doctors are comprehensive doctors, but they don't do surgery. They don't go to the hospital with you and do surgery. If God forbid something terrible happened and you had an accident and you need to be in the hospital for a couple of days, they don't cover that. So there's a real role for insurance. We're not suggesting get rid of insurance.
Right.
Um, but this part of healthcare, the 90% that everyone needs a quick prescription or they have a cold or a flu or they scrape their knee, that stuff should be predictable and that stuff should be affordable, really easily accessible, convenient. That's the stuff that I think we're trying to change. When we talk to nannies and families, you know, nannies actually tell us all the time they have health insurance, but to your point, they're so scared of the bills, they can't get access that when they get sick, they just let themselves stay sick for 4 or 5 days. Then they get sicker, and then they unfortunately have to take a longer period of time off. That's obviously not good for the nanny, and it's not great for the family that they
Right.
have a sick nanny at home who's avoiding the doctor or can't get access to a doctor. So, I think providing some basic health benefit is just a win-win for everybody.
Save the health insurance for when you really, because let's see, physical, my eye, which is like every quarter, I have to have
Mhm.
the check every quarter. But if it wasn't for my I, I exercise, I try to eat well, mostly right. I'm not going to even lie about the mostly right. I take vitamins. I do my pineapple and ginger water to help fight off those free radicals. And I did the research on different foods to eat because I know my body cannot take a lot of medication. I'm allergic to a lot of medicines. And so I try to do make food my medicine. So whatever is ailing me, I need this food. This is going to help cure that. It may take a little longer,
Mhm.
but I know the medicine that they're going to give me is either going to make me uh make me pass out because anything that causes
Yeah,
drowsiness, I'm out for 2 or 3 days. I don't need all that. If you give me something that even my allergies, I
yeah,
can't take regular allergy medicine because it knocks me out. So I go with the homeopathic. So I'm always taking these herbs and things and then when I say herbs, I'm not talking about marijuana. I don't do that because that makes me nauseated and sick. So
yeah.
even though because of my eye I could, but I don't.
Hmm.
So I try to take care of myself through the foods that I eat and the way I stay away from, alcohol because,
Yeah.
I think I'm allergic to it too. Because one sip and I'm like, hey, and I don't want to embarrass myself in front of anybody. But if you are one of those nannies who is pretty much in good general health and all of a sudden something happens and you need a doctor, you don't need surgery, but you do need a doctor to check it out. This
Yeah.
is a great thing to have.
Yeah.
And I'm paying you $75 a month as opposed to $700 a month for my, you know, insurance. Now, then I can afford that high deductible because
Yeah.
I'm not going to the doctor like that.
Yeah.
I can go to use this plan and I'm good. I'm cool.
Yeah.
Yes.
Yeah.
So,
Angela, you brought up something. Most of the doctors that we work with also think very holistically, and many of them are actually trained in alternative medicine as well as Western medicine.
mhm.
Um, and I'll tie this back to maybe an earlier comment you had with your own doctor, where you were in and out in a couple of minutes, being herded in and herded out. The reality is a lot of doctor appointments these days are 5-6 minutes long each. You go in, you get to talk about one thing. The doctor listens to that one thing and prescribes you something without probably giving it that much more thought, and you're out the door, right? And that's, again, just not, I think, the care that the doctor wants to deliver. It's also not the care any patient wants. So when you actually have unrushed visits, 30 minutes, or however long you want, it could be longer, it could be shorter, depending on what it is. The doctor can ask you a couple more questions. They can get to know you a little bit better. They can get to know more about what you value. Not everyone wants to just have a prescription and then go home. They want to think about, are there other ways we can treat this without just getting medicated?
Right.
And so when the patient and the doctor both have that time to think holistically and to get very specific and personal with their care, it's just better for everybody, better outcomes for everybody as well. So
Yeah.
I think the key to our model is more time, consistency, access. Those are the things that we think just deliver better healthcare.
Okay. So now, if you all are looking for Taro Health, uh, that scroll that's going on the bottom of the screen, check them out to see where they're located, where the areas that they're serving now. And I'm sure they'll be adding areas as it become available. They'll be adding more areas to the list. But I've checked out the website and it's pretty good. I like it. And if I don't get lost on a website, y'all doing good because I hate going to search for something and it's like under the subtitle, under that title, and then you got to go around the corner and through the hallway to get to it. I'm like, Well, shoot, I could have looked this up on somebody else's website and found it. I could have asked Dr. Google the question instead of trying to find and dig. And I don't like having to dig to find the answer. If it's that important to me, I need it right away, it's only going to frustrate me if I got to go, you know,
Yeah.
the street, around the corner, through the
Yeah.
it's an obstacle course. I don't like obstacle courses when it comes to my health. I need to know now. That's why I'm here.
Yeah.
Leave it directly. But I went to the website and it's straightforward. So you can find what you need when you need it and be on your merry way. Because
Perfect.
we get that is most of the time we do our searching during nap time. And sometimes that baby doesn't sleep. You have a 14-month-old, you know what I'm talking about.
Oh,
And
we
you're
know.
like, okay, so during nap time, I'm going to do this. And that 1 hour and a half stretches down to like 30 minutes. And you got to throw food down your throat in the middle of it. Oh, he's up already. Okay. Yes. And you're rushing. And, we don't have that much time to go looking and searching and doing whatever.
Yeah.
We need it lickety split, got it, done, out.
Yeah.
So we need it easy and convenient. So I promise you, it's easy and convenient. If I could do it, and y'all know I'm not that tech savvy. I got a few technical things, but I'm not that tech savvy. So if I can do it, you all can do it. Okay.
Yeah.
So check out tarohealth.com/nanny. See, it even takes you to the nanny section.
Yeah.
The nannies, we got a whole section, y'all. Go to the section that says nannies, and you bada boom, bada bing, you done.
Yeah.
There you go.
Yeah.
So, did I miss anything? Is there anything else we need to know that I did not ask?
No, I think we covered it all. We're excited to, I think, support the nanny community here, and we're always growing and learning. So yeah, feel free to go to the website, reach out to us, and we're happy to help.
Yes. So if you all know anyone who is in the Boston area, New England area, I know Sarah knows a lot of nannies up there.
The DMV area, DC,
DMV. Oh my
Maryland,
gosh.
Virginia. Yep.
Yes, I know some people in the DMV. I have that they haven't contacted me back. But yes, I'm gonna be on top of them. But you all spread the word, spread the word, spread the word, and tell them that Laura, well, through me, Laura, through me. Okay, Laura sent you to me to what I sent you to them. Okay, so just remember where you heard it first. Okay.
That's right.
Thank you, Jeff, for explaining this to us and for bringing something to the table that we can use. It's been a minute.
Yeah.
Something specifically for us. Okay, nannies, let's take advantage of this. Look into it. Talk to your families. Do you all have a letter or something that we can just kind of slide in the email for our families?
We do.
Like,
we actually do have one pagers, brochures, things like that. So we have resources for both nannies and for families. So like I said, reach out to us and we'll send them over.
Okay, nannies, here's the plan. I looked up something and I need you to look over it. Slide it in the email. You know, if it's coming from you, it may take a minute for them to look at it, but because it came from you, they will look at it. Slide it in the email. You know, if you have that book, that daily log, slide it on, today's log. Okay, here you go. Put it right on top of there, so they can see it when they open the log to look for it. Oh, attach it to the page, staple it. So they have to flip up the page and look, what is this she got on here? Yes. She said, first you need to move further south. And Shannon says, thank you. I look forward to you coming to GA.
Yeah, we'll get there.
And Barbara says, I'm in Los Angeles.
We'll get there eventually.
We'll get there. You cross the nation. We're coming that way. Okay. Any luck on the west side? We're working on it, Barbara. We're working on it. So, but yeah, slide it on the page, just kind of, y'all know how to do when you need their attention and you need them to see something. Y'all know what gets their attention. I'm just making some suggestions. You know what gets their attention? That's what you do. Put it where, they can see it and, it won't get ignored because as a benefit to you, as a bonus, hey, Christmas bonus, here you go.
Mhm.
Oh, anniversary bonus. Here you go. We're going to add some health insurance, some health care
Healthcare.
to your as a bonus for you being our child's nanny. We're going to add some health care to you. We're going to pay for some health care for you so you can go to the doctor. Hello, benefits. That's all I'm saying.
Right.
Benefits. Okay, so you all, let's see. Is next week the first Monday? I do believe it is.
I think so. I think we're
Yes,
already in May.
next week is the first Monday of the month. That means that we are having our roundtable discussion next week. So you all be here with your 2 cents coming at your 2 cents to the roundtable discussion. And thank you again, Jeff, for sharing with us. Uh,
Thank you for having me.
Going to the doctor shouldn't be an impossible luxury.
We
Yes,
agree.
exactly. I totally agree with you. I totally agree. Okay, let me run my banner right quick while I'm where is it? There you go. If you all want to follow me here on Ask the Nanny. Also have a TikTok page that is blowing up at the moment. I didn't expect it, but it's just going like wildfire. Um, but join me there too. If you, I'm at AT Nanny on TikTok. Look me up, follow me. I'll follow you back. Okay. Now, we will see you all next week. Those of you who are joining us from YouTube, thank you for joining us. And we will see you all next week. You all have a great week now. See you later.
Bye. Thank you.